Thanks for watching. This is YouTube Medical University. Certainly, but I have to tell you all something shocking. What if I told you that a certain symptom that appears on your legs actually lowers your 5-year survival rate more than having colon cancer or breast cancer? Many of you might think it's an exaggeration to say that just a symptom on your legs could be that serious. However, blood vessel problems in your legs. A frightening statistic shows that 1 in 3 people with peripheral artery disease will die within 5 years. On the other hand, the 5-year survival rate for breast cancer in Japan is about 90%. Even for colon cancer, it's 70%. The numbers clearly show how important leg symptoms are and that they shouldn't be ignored. Mr. A man in his 60s who recently came to my outpatient clinic, had exactly those symptoms. Doctor, lately when I walk, my calves start to hurt. That's what he told me. These kinds of symptoms, which could happen to anyone, can actually be a life-threatening warning from your body. It was actually an SOS signal from the body. Many people think that the aging of their blood vessels, in other words, arteriosclerosis, is something that will only happen in the distant future. However, it's possible that it's quietly and steadily progressing inside you right now. You might not expect it, but signs on your earlobes or symptoms in your jaw can actually be unexpected warning signs of arteriosclerosis. Today, I'll introduce some surprising danger signs of arteriosclerosis. By the time you finish watching this video, I think you'll clearly understand how scary this can be and how dangerous it is to ignore these symptoms. In the video's second half, I'll show you how to check your blood flow by observing your palm color. I'll introduce 3 self-check methods like that, so please watch until the end. So here's today's agenda. First, in the first section, I'll briefly and clearly explain what arteriosclerosis actually is. Then, in the second section, I'll introduce the 8 SOS signs from your body that you absolutely shouldn't miss. And in the third section, I'll introduce 3 self-checks you can do starting today to protect your life. At YouTube Medical University, we provide easy to understand medical information that will be useful starting tomorrow, all from the perspective of a practicing doctor. It's very important to have at least one reliable source of information. Please subscribe to the channel now so you don't forget which one it is. First, I'll clearly explain what arteriosclerosis is. Simply put, arteriosclerosis means that your blood vessels are aging. You get spots and wrinkles on your skin, right? In the same way, our blood vessels also become harder and lose their elasticity as we age. Just like a kitchen drain gets clogged and doesn't flow as well after many years of use, our blood vessels also gradually deteriorate over time. That's the idea. Excess cholesterol flowing in the blood gets deposited on the walls of the blood vessels. As it builds up, that fat accumulates and forms lumps called plaques like this. When these grow, they can block blood vessels, break off and cause blockages elsewhere, or rupture damaged vessels. The risk of these events increases, which is called arteriosclerosis. What's scary is that this kind of arteriosclerosis usually progresses without any symptoms. If it's your skin, you can look in the mirror and notice more spots, but you can't see your blood vessels just by looking. By the way, if we include even the capillaries in our bodies, there's a fun fact based on an old estimate that says we have enough blood vessels to go around the Earth 2.5 times. It may be an exaggeration to say 2.5 times around the Earth, but it's roughly 10,000 kilometers, about the length of Japan north to south. We have more than that amount of blood vessels spread throughout our bodies, delivering oxygen and nutrients to every corner. That's the role they play. I think you can see that taking care of these blood vessels is directly connected to protecting your overall health. So now that we've learned a bit about arteriosclerosis, let's discuss the signs that appear as it progresses. Signals from your body you shouldn't ignore. I'll share 8 warning signs. So, how do we recognize the silent SOS signals from our blood vessels? Actually, the key point to look at is your legs. It was the same for Mr. A at the beginning. Actually, the legs are the farthest from the heart. In other words, the road from the heart is the longest. This process increases the risk of arteriosclerosis, especially toward the end. The blood vessels become thinner and thinner, so even a small buildup of plaque is more likely to show up as symptoms. Remember, the legs are key for noticing symptoms. They're like a second heart and very important, so please don't overlook them. Of the 8 signs, the first 5 are grouped as leg signs, so please listen carefully. The first of the 5 SOS leg signs is coldness or numbness. Many of you have likely heard this before. Recently, a woman in her 70s named Ms. B visited my clinic. She said, "I have always been sensitive to cold, but over the past year, only my left leg has felt colder. Extra socks or baths don't help." She asked me about this. Why did Ms. B start feeling cold and numb? You likely know the answer. Arteriosclerosis in her leg had reduced blood flow. Blood vessels are similar to highways. If we think of blood as cars, then what the cars are carrying. Energy and oxygen are delivered to the legs, but if the blood vessels become narrow, it's like a traffic jam occurs. When that happens, it's harder for energy to reach the legs, so it's also harder for your feet to get warm. And when there's not enough energy and your legs can't function properly, abnormalities occur and you start to feel numbness. I think it's easier to remember if you understand the reason behind it. And while understanding the reason can be difficult, it's very important to avoid being misled by incorrect information. Knowledge is a weapon, so let's learn together. Here are 5 SOS signs that appear in your legs. The second one is this: pain in your legs when you walk that goes away when you rest. This symptom is called intermittent claudication. It's a difficult term, so you don't have to remember the name. You get this unusual symptom in your legs where it hurts when you walk, but it's fine when you're not walking. If the pain were constant, you'd likely think something was wrong and visit the hospital. But since it stops with rest, many people ignore it. Yet, this symptom is actually very dangerous. Why does it hurt when you walk? Our bodies have muscles, right? Let's think of these muscles as factories. When you're at rest, the factory is operating normally. But when you move, in other words, when you move your legs, muscles require a lot of energy. It needs oxygen. But if arteriosclerosis is progressing in your blood vessels, that oxygen and nutrition can't reach the muscles properly. When that happens, the factory runs out of fuel and stops working, signaling pain as symptoms. And then, once you stop and the factory gets to rest, the energy and oxygen decrease, right? When that happens, the energy becomes sufficient, so the pain symptoms subside. Intermittent claudication is actually quite frightening. Data shows the 5-year survival rate for those with this symptom is only about 70%. Don't ignore it. Thinking rest will help. If you suspect it, consult your primary care doctor or a cardiologist. Here is the third of the 5 SOS signs that appear in your legs: changes in the hair or nails on your feet. Isn't this surprising? Have you noticed the hair on your toes getting thinner, or your nails becoming thicker or growing more slowly? Is there anyone experiencing these symptoms? Why do these symptoms occur? Actually, our bodies are very smart and efficient. When arteriosclerosis progresses and blood flow throughout the body is reduced, our bodies are designed to send blood to the most important organs first. Blood flow mainly goes to vital organs like the brain and heart, while less reaches areas like the skin, nails, and hair. The blood flow to these so-called decorative parts gets pushed to the back of the line. As a result, they stop receiving enough nutrients. The hair roots decide to stop producing hair and switch to energy-saving mode. That's why the number of hairs can decrease and the hair itself can become thinner. The same goes for nail cells. When metabolism gets worse, nails can become thick, deformed, or grow more slowly. Lately, even though I haven't cut my toenails, they just don't seem to be growing at all. If you notice that the hair on your toes has suddenly become thinner, it could be a sign of arteriosclerosis in your legs. Here are 5 SOS signs on your legs. The fourth is this: it's a symptom where wounds on your legs heal poorly. Why do wounds heal poorly? If you've watched this far, you probably have some idea. When we get injured, our bodies repair the wounds. It's like doing restoration work. To restore something, you need materials, workers, and energy like electricity. Similarly, to heal leg wounds, you need nutrients, materials, and workers. You need cells responsible for immunity, and you also need energy. In other words, oxygen. The blood vessels are like roads that transport these necessary substances. As arteriosclerosis advances, blood vessels narrow, and blood, like vehicles, can't pass through. As a result, the repair work doesn't progress, and it's like leaving the debris as it is, so the wounds don't heal. These kinds of symptoms often appear in diabetes actually. It's clearly stated in the guidelines of the Japan Diabetes Society, but diabetic patients can have damage to the blood vessels in their feet, which can lead to gangrene. That is, the cells in the feet can rot. In some cases, this can result in a situation where amputation, having to cut off the foot, becomes unavoidable. About 80% of cases that lead to amputation actually start with a foot ulcer or a wound on the foot, where bacteria get in and the condition progresses from there. In other words, a small wound can be the starting point that leads to such a serious situation. It might not sound like a big deal if you feel like wounds on your feet have been healing slowly lately, but actually, if you leave those wounds untreated, bacteria can get in and it becomes a serious risk. It's really important to pay attention to how well your wounds are healing. Since it's hard to notice on your own, try keeping a diary or taking photos yourself to keep track. I think being careful about this is very important. Here is the fifth of the 5 SOS signs that appear on your feet. It's when the color of your feet looks off. For example, if your feet have recently become pale or, on the other hand, have turned a reddish-purple color. Have you ever noticed that? When you raise your feet above your heart, gravity makes it easier for blood to flow from the veins back to the heart. If you have arteriosclerosis, raising your feet while lying down makes it harder for blood to flow from your heart to your feet. As arteriosclerosis in the legs worsens, it's difficult to get enough blood to the extremities. The skin's redness fades and your feet become pale and discolored. And what happens when you lower your feet? When you lower your feet, gravity works against the heart, so blood flow to the feet becomes easier, right? But what happens then? This time the blood has to return to the heart through the veins, going against gravity. When arteriosclerosis progresses, the overall blood flow stagnates, making it difficult for blood to return to the heart through the veins. As a result, blood pools and the color of the venous blood changes. Not a bright red, but a reddish-purple discoloration appears in the feet. I think it's easier to understand if you consider the reason behind it. So, for people with poor blood flow in their feet, they don't feel pain when their feet are lowered, but conversely, when they raise their feet, pain appears in their feet. Some people report these symptoms, which can indicate arteriosclerosis in the legs. Don't ignore them. Consider seeing a doctor. So, I have introduced 5 SOS signs that appear from your feet. The other 3 of the 8 appear from places besides the feet. I'll share some surprising signs of arteriosclerosis. At YouTube Medical University, we make medicine easy and interesting by explaining why these symptoms occur. Subscribe to the channel to catch all new videos. 3 unexpected SOS signals can appear beyond your feet. The first is a yellow lump forming on your eyelid. If you notice a yellow lump on your eyelid, check this image. This is called xanthoma. It's written as yellow tumor and pronounced as xanthoma. The main cause of this is closely related to high cholesterol levels. Please imagine that a lot of low-density lipoprotein cholesterol, commonly known as bad cholesterol, is accumulating in your blood vessels. Our bodies are designed to store cholesterol when there is too much of it. But if cholesterol increases too much, it starts to build up in various parts of the blood vessels and organs throughout the body. This cholesterol gets temporarily stored there. It tends to accumulate, especially in areas where the skin is thin, and it is more noticeable in those places. In other words, the yellow lumps that form here are actually made of fatty cholesterol. For many people who show these signs, it means there is a lot of cholesterol in their body, so please be careful. In fact, a large-scale study conducted in Copenhagen found that people who have these small yellow spots on their eyelids have about 1.5 times higher risk of heart attack compared to those who don't. Whether you know this or not can help you understand what kind of illnesses you should be careful about, so please remember this. A second surprising SOS sign outside your legs is a deep diagonal earlobe crease. Look at this image. Why is there a link between an earlobe crease and arteriosclerosis? Fascinating, isn't it? Actually, the earlobe is similar to what I mentioned earlier. It's not an important organ, right? In other words, the priority of the earlobe for sustaining life is low. When chronic poor blood flow occurs due to arteriosclerosis throughout the body, the blood flow to the earlobe is also reduced. As a result, the collagen fibers and elastic fibers in the earlobe become fragile, causing the tissue to thin out. You can imagine it as if the tissue is shrinking. These kinds of changes appear, and as a result, the support is lost. It is believed that the earlobe loses to gravity and wrinkles appear. Wrinkles on the earlobe don't always indicate arteriosclerosis. Some studies support this link, while others do not. This isn't decisive, but knowing about it might make you wonder if arteriosclerosis is progressing and prompt you to check for other symptoms. It could also encourage you to reduce smoking, monitor your blood pressure, or watch your blood sugar levels. Most importantly, it could be useful trivia, so I hope you find the human body interesting and enjoy learning about it. Here's the third unexpected SOS sign that shows up beyond your legs. It's shoulder or jaw pain during exercise. Those of you who have studied this a lot probably already know. Pain in your shoulder or jaw can actually be a warning sign from your heart. The heart is always working, but there are blood vessels running along the surface of the heart that supply it with energy. When these vessels develop arteriosclerosis, if the heart works harder, like when you're physically active, there can be a shortage of blood flow and pain is triggered from the heart. The electrical signals of this pain travel through the spinal cord to the brain, but actually the electrical signals from the heart and those from the shoulder or jaw travel along the same pathway. So from the brain's perspective, it can't tell if the signal is coming from the heart or from the jaw or shoulder, and it gets confused. This leads to an interesting phenomenon where we mistakenly feel as if our shoulder hurts. This is called referred pain. So when you feel shoulder pain during exercise, you might think you should see an orthopedic doctor, but actually this could be a sign from your heart. Since the heart is more to the left, shoulder pain usually occurs more on the left side, so keep this in mind. Please comment on anything surprising, what led you or others to notice arteriosclerosis and what you want to remember. Even a single word is fine. Leave a comment to help you remember better. In this last section, I'll share 3 self-checks you can start today to protect your life, like checking blood flow by watching this video and noting your hand color when pressing on its blood vessels. Severe drowsiness, often discussed in health programs, can indicate carotid artery sclerosis. People often say that, but actually, intense drowsiness after eating is caused by it's usually due to a quick spike in blood sugar or a drop in blood pressure. The next blood vessels are large, with blood flowing through different paths. Sudden stoppage of blood flow after eating is very rare, so accurate information is important. So, from a doctor's perspective, I'll explain how you can check the blood flow in your own body. I'll explain 3 self-check methods. Please try them out while watching the video. The first is checking the pulse in your foot. Please take a look at this image. Actually, you can feel the pulse in your foot. You can also feel the pulse in your arm by touching here. There are also points on your foot where you can feel the pulse. Today, I'll cover 2 points. First is the pulse on top of the foot. When you lift your big toe, the tendon tightens, right? You should feel a single hard line pop up. This is the tendon, the one that stands out like that. Gently touch the area on the side of the tendon closer to your index toe using your index and middle fingers. It might be hard to find at first. Try touching around here and there thinking, is it here? Is it here? See if you can feel the pulse. You should be able to find a spot where you can feel it. This is the pulse on the top of your foot. If you're healthy, you should feel it on both feet, not just your right. If you press too hard, the pulse will disappear, so remember to touch gently. If the pulse feels the same on both sides, there's usually no issue. If you can't feel it or it's much weaker on one side, blood flow in that leg may be reduced. And the second pulse point is behind the ankle bone. Please look here, it's right behind the inner ankle bone like this. There's a blood vessel here too, so gently use your finger pads to feel it the same way. If you do that, you should be able to feel the pulse of blood flow. It's harder to feel this pulse than the one on the top of your foot, so don't worry or think something is wrong if you can't find it. If there's a difference between the left and right sides, or if you can't feel it on one side, it could mean that the blood flow in your foot is reduced. The second way to check is even easier. This check involves looking for changes in the color of your toenails. You can also use your fingernails, but everyone, please show your toenails. Press down firmly on your big toenail with the pad of one of your fingers. When you press and then release, you'll see that your nail turns white for a moment. Please take a look, but after a while, your nail should return to a pink color. This is a check to see how long it takes for the color to return. Press down on your nail for 5 seconds. 1, 2, 3, 4, 5. And when you quickly release, if the color returns to pink within about 3 seconds, blood flow is usually normal. On the other hand, if it takes more than 3 seconds, there may be decreased blood flow to the extremities, so please try this simple check as well. And finally, there's a test to check the blood flow in your hands. This is known as the Allen test. Since arteriosclerosis affects the entire body, symptoms may also show in your hands. It's possible. Actually, the blood vessels in your hands have a backup function. In other words, there's insurance. Blood flow from the thumb side and the little finger side merge and flow to the fingertips. So as long as one side is flowing, the blood flow in your hand should basically be maintained. The Allen test takes advantage of that structure. First, please clench one hand tightly. While in this state, use your other hand to press firmly on both sides of your wrist, the thumb and little finger sides. Apply considerable pressure. Quickly open your hand now. See how pale it looks? This is where the real test starts. Quickly release the finger that's pressing on the little finger side. Did you notice how the entire palm turned red? This happened because blood flow returned from the little finger side and spread throughout the hand, causing it to turn red again. Now count how long it takes for the color of your palm to return to red. In many clinical settings, if it returns to a pink color within 5 to 10 seconds, it's considered normal. If the color returns slowly or appears mottled, it could mean that blood flow to the hand is poor. Please pause the video and try it yourself. However, you need to be careful because this test should be done by medical professionals. If not done correctly, you may not see the changes accurately. Just because it doesn't work well doesn't mean your blood flow is poor. This is just a rough guideline. In a clinical setting, another person can firmly press both sides of the hand to ensure the test is done correctly. Doing a self-check on your own is a simple method, so please remember it. Let's review what we talked about today. Arteriosclerosis is blood vessel aging that occurs without symptoms. And if your body does send out SOS signs, they often appear in your legs first. Be sensitive to any changes such as coldness, pain, wounds that are slow to heal, or changes in your nails. And there are also the 3 self-checks I mentioned earlier, so please give them a try. Thanks for watching this long video to the end. Trying to be perfect about health can be exhausting, can it? Rather than trying to do everything, lower your standards and focus on one thing to improve your health. For example, after taking a bath, check your feet for any injuries, or before going to bed, try feeling the pulse in your feet. Tomorrow, when you go up in the elevator, try using the stairs just once. Even doing just one of these things is fine. Even small habits add up and shape your future health. Please take your health seriously. I think the fact that you watched this video all the way to the end is already a big step, so I'd be happy if we could continue learning together from now on. So if you enjoyed this video, I'd really appreciate it if you could give it a thumbs up or leave even a short comment. Don't forget to subscribe. See you in the next video.